Run home, Peter. Run as fast as you can. Ah! Ah! Ah!
Hey, you okay? You look like you're in so much pain.
This hurts so bad. My shin hurts so much. It gets worse and worse with running. I knew I should have done a proper warm-up. Usually if I do, it doesn't hurt this bad.
You know, I think that happened to me too when I was running. There's so much pain, but I switched to running bare feet, and that helped so much. I think that was the cure. You should go talk to your doctor about that. Go.
All right, hurry up. Next patient. I'm getting paid by the visit. Have a seat.
Hi.
Hey, my name is Doctor. What can I do for you today?
Well, I've been having a lot of pain in this area, especially when I run.
Okay.
Yeah.
Lower leg area?
Yeah.
All right. Tell me a little bit about yourself.
Well, I'm training for a marathon, and I've been running about 20 or 30 kilometers every week.
Okay. So I got a couple questions for you. When does it usually occur?
It occurs when I'm running, and it gets worse when I'm running longer distances, and it especially hurts when I don't do a proper warm-up.
All right. How long have you had this pain before?
About 5 months now.
All right. On a scale of 1 to 10, about how intense is it?
I would say around an 8.
An 8?
Yeah.
Okay. I have a couple questions about your history. Do you have a history of lower leg injuries?
No.
Maybe in your family?
Not that I can think of.
Okay. Any prior surgeries that I should know about?
No.
All right. You know what? I've actually seen a majority of people who are similar to you in that they are runners. And I believe that you have what we call in the medical community medial tibial stress syndrome. It's actually one of the most common injuries for runners like yourself.
Have you heard about barefoot running? This guy on the street recommended it to me, and I trust him. I think it would be worth looking into.
You know what? I've actually read several journal articles about it. Let me go through them with you on the blackboard.
First of all, let's outline some of the learning objectives. Our patient was diagnosed with medial tibial stress syndrome. By the end of this lesson, you should be able to 1. Explain the 3 key elements that define medial tibial stress syndrome. 2. List the 3 risk factors of medial tibial stress syndrome. And 3. List the 3 differences between barefoot running and shod running.
Quick quiz. Before we begin, let's see what you know currently. Pause the video and discuss some of the reasons why one would switch running from traditional shoe running to barefoot running or vice versa. Next, pause the video again and discuss with your partner the potential risk factors of our patient for getting MTSS.
With that being said, let's go on to define our case. For our patient's history, she has told us that she has had no prior injuries. She has had recurrent pain in her right shin that progressively gets worse the longer she runs, suggesting that this is a chronic condition. The relevant risk factors that we should be concerned about is her larger Q angle, being that she is a female, her higher BMI, which may result in flatter feet, and an overpronated foot during running, which is common for people with flatter feet. Lastly, her long-distance running hobby may also contribute to her flat feet. It is highly likely that she has medial tibial stress syndrome. MTSS is an overuse injury that many runners encounter. It is commonly known as shin splints and has had reported rates from 4% up to 35% in soldiers, runners, and athletes involved in jumping activities. Pain is typically reported in the lower third of the tibia on the posterior medial side, and some evidence suggests that it is caused by repetitive rubbing of the soleus, tibialis posterior, and flexor digitorum longus, as well as repeated tibial bending. In a review from the Sports Medicine from 2009, there are high level of evidence that overpronation of the foot and female sex are intrinsic risk factors of MTSS. There are also some evidence that show that internal and external hip range of motion, higher BMI, and leaner calf girth are correlated with increased risk of developing MTSS. There has been no clinical randomized trial that has found specific treatments that is effective in treating MTSS, but current best practices have suggested a treatment plan of rest, ice, calf muscle training, and many more. The question now is what sort of prevention strategies are out there right now? In our current clinical case, we are looking for the role that footwear will have on MTSS.
Now, let's dive right into the conversation about barefoot running. Many studies conducted on the biomedical differences between barefoot and shod runners have found that barefoot runners typically landed on their forefoot first, whereas shod runners displayed a rear foot strike pattern. Forefoot runners typically generate lower peak impact forces compared with rear foot strikers. Shod runners naturally rear foot strike because of the elevated and cushioned heel of the modern running shoe. Furthermore, even on hard surfaces, barefoot runners generate smaller collision forces than individuals wearing standard cushioned running shoes. Lieberman et al. 2010 found that kinematic and kinetic analyses show that even on hard surfaces, barefoot runners whose forefoot strike generate smaller collision forces than shod rear-foot strikers. The difference results primarily from a more planted flex foot and a greater knee flexion angle at landing, which decreases the effective mass of the body that collides with the ground. In fact, forefoot and midfoot strike gaits were probably more common when humans ran barefoot and may protect the feet and lower limbs from some of the impact-related injuries now experienced by a high percentage of runners. By landing with a forefoot and or midfoot strike rather than with a heel strike, barefoot runners are able to disperse impact forces more efficiently.
Now we will summarize the literature against barefoot running. A study was conducted that compared the injuries incurred using various footwear over a 12-week period. 103 runners were recruited with a different feet type. They either had neutral, mild pronation, or mild supination. They were all randomly assigned to one of three groups: a control group using a neutral shoe, a minimalistic shoe, and a partial minimalistic shoe. The participants went on to complete a 12-week training program during which the training intensity gradually increased for 10 weeks and then followed with a tapering of intensity 2 weeks prior to the 10-kilometer event. The conclusion revealed that changing footwear does not reduce the overall incidence of injury, but rather it just modifies the risk of injury. More runners had experienced pain in the shins and calf area when running with a minimalistic shoe. Furthermore, the adoption of a forefoot for strike pattern may have contributed to a greater load on the Achilles tendon and triceps surae musculature. Another study specifically compared the incidence and rate of injuries between shod and barefoot runners over a 1-year period. 226 participants were recruited and randomly assigned to two groups. There were 108 shod runners and 118 barefoot runners. The barefoot runners were instructed to run half of their total mileage barefoot, with the remaining half with minimalistic shoe. Similarly to the previous study, the results revealed that barefoot runners sustained a statistically greater number of calf injuries and less knee and hip injuries. Additionally, they incurred less plantar fasciitis. The literature supports the notion that barefoot running alters the risk of injury rather than reducing the overall incidence of injury. With that being said, pause the video and try going for a quick jog around the house or neighborhood with the opposite shoe type that you currently wear. How does it compare to your regular running pattern? Did you find that your strike pattern had changed?
In conclusion, each type of running conditions have their own advantages and disadvantages. Let's summarize the main points we talked about. This patient may want to switch to barefoot running because it promotes a forefoot strike pattern, which in turn reduces the ground reaction forces that transmit up the kinetic chain. Barefoot running has also been associated with a shorter stride length and thus reduces the loads on the hip and knee. As a result, injuries related to hip adduction such as stress fracture, iliotibial band syndrome, patellofemoral pain syndrome are all reduced. However, this patient may wish to continue using traditional footwear because the literature supports the notion that barefoot running only alters the risk of injury rather than reducing the overall incidence of injury. Also, although barefoot running may promote a forefoot strike pattern, runners that naturally rear foot strike may not necessarily change their running gait simply by switching to barefoot running. Overall, transitioning to barefoot running will not increase or decrease the overall injury incidence, but instead modify the risk of injury. Now, let's go back to the doctor's office.
So with this in mind, and because I am a doctor, here's what I'm going to recommend to you. Maybe you should take a break from running to alleviate some of the pressure on your lower leg. Do some activities that are less stressful, such as swimming. And if you want, I can refer you to a physiotherapist too.
Thank you so much. That was so helpful.
All right, have a good day, miss.
Thank you.
With all the information being presented, has your reasoning regarding shoe conditions changed? Let us know what you think and write your comments below.